My name is Jozi Stables. I'm the home manager at Glencairn Care Home. We're based in the heart of Edinburgh. We're a 26-bedded residential care home. The biggest improvements that we've seen, one of the biggest ones has been the reduction in severe pain for our residents. So overall, we've had, since we started using PainChek, a 100% reduction in severe pain levels with our residents, with the last 3 months being consistent with no pain or low pain. So we've seen a reduction in our stress and distress levels within our residents. It's, increased the morale of our staff, because supporting residents through these times is really difficult for staff to try and support, and even just being part of that experience takes a lot, a lot of time and a lot of, energy, and it's quite emotional sometimes, these experiences. So having managed to reduce the overall stress and distress levels is seeing an increase in our staff morale. It is seeing a lot of benefits in our residents' wellbeing. We are witnessing residents taking part in more activities, staff having more time to spend with residents to do things that really do support their wellbeing, not just the clinical side of it. So it's not just a case of the staff are saying, okay, this person's not experiencing pain anymore, that's great. They're now saying, right, this person's not experiencing pain anymore, or we've managed better this pain. Let's see if they can now take part in this activity, whereas before it's maybe something that they wouldn't have been quite interested in because of what they were experiencing at that time. We've witnessed a lot of, personal results for residents, and that's been residents who have increased mobility, residents that are now going on trips that they weren't before. We've actually had residents who had specialist support seating because of their levels of discomfort, who are now sitting in normal lounge chairs, and they're so comfortable doing that, and they're part of sort of that community again, if you like. So PainChek has been great in helping us identify residents who are experiencing pain that aren't able to communicate with us and tell us that they're in pain. On the plus side of that, we also have residents who are very residential within our setting, who are very independent, and we've used the NRS system with our residents to continue to promote their independence, to keep them fully involved in the process, to make it as personalised as possible for each individual, and keeping them fully involved in these assessments. So residents are able to say to us, I'm in pain, can I have some medication to manage my pain? So absolutely yes. Sit with me and answer some of these questions first, and then we can then take action on the pain medication. And it further supports us with our data, with our records, to continue to manage, especially with residents involved in completing their own assessments. It gives us more evidence for to go to the GP and say, this isn't working, can we try this? This resident has been fully involved in experiencing these symptoms, and they have made us aware of their pain on these occasions. It's all about empowering our residents. That's what we're very passionate about here. And I think with the introduction of a tool like this, there is always a fear that, it might replace an aspect of care, which absolutely is not the case. If anything, it enhances resident care, but also empowers our people to remain fully involved in their care. And it's not just that, people are in a care setting and, staff are taking over these aspects of their life. They remain fully involved in the process where they can. My advice would be to anybody who's interested is find out about it, talk to people who have used it, get their experience on it, and I would highly recommend it. Absolutely would recommend it in your setting. I think seeing residents experience less stress and distress, receive medication that they didn't need, to be discontinued, to then build up stronger relationships with your GP practice, building that trusting bonds with people. What more could you want?